those of you who may remember back here 20 or so years ago when Blue Cross Blue Shield of West Virginia was liquidated because it was insolvent, I would argue that any aspect of the healthcare delivery system is much better being profitable and solvent than it would be on the other side of the coin. But you know, if you're going to make an argument against for-profit, then you need to look at the hospitals, you need to look at the physicians. Everybody's out there who's trying to establish it from a business perspective. I think you need to look across the entire spectrum. And I would argue in debate that model is actually the most viable system to do it under. Can we be more effective, more efficient? Yes, I think we need to examine every aspect of it, because I don't think a public plan is the way to get about it.
Between the deductibles and the payments, our insurance would have cost us $21,000 a year. I'll take 14% of my income any old day and put it in taxes. Because that was crazy, and we could afford to pay. And consequently, we did not get insurance. We did, and that was without any prescription coverage. This was not one of the gold standard policies or anything like that. We did not get insurance. When we got sick, we did not always go to the doctor. We didn't always get our medication. So there are a lot of downsides, as a lot of people here know, to not having insurance and not working for somebody who's providing insurance. Second thing I want to bring out is that I now work for the West Virginia Association of Free Clinics. The 10 clinics around the state are seeing thousands of more people a year because of layoffs, because of plant closings, any number of reasons. And I just want to make a comment that these people have either been working or are now working, paying their taxes, and between 85 and 90% of the people we see are working Americans who cannot afford to get medical care. And I think we need to pay for it.
Well, we got to the point of our program where we have closing remarks, and I'm starting from my left, I'll start from my right, and start with Louise.
Thank you all for being here. You've asked some good questions. We do have a long way to go. Welcome questions afterwards to learn more about community health centers or to offer suggestions as to ways in which we can also engage our communities and making this don't happen. Thank you.
Thank you, Louise.
I want to quote Winston Churchill, who said, you can count on Americans to do the right thing, but only after they've exhausted all the options. And I think we're getting close to exhausting all our options, but I think tonight's forum was a good example of how folks can come together, listen to different opinions and perspectives, and hopefully we will make our way through this and come out stronger as a result. AARP's mission is to make sure that our members' voices are heard in the national debates that affect the future. We've been working with Republican and Democrat leaders for years and will continue to do so. I want to be clear that AARP has not endorsed any of the comprehensive health care reform bills, but we are fighting for a solution that will improve health care for our members. And at the end of the day, the standard that we'll use to judge legislation will be simple. Will the legislation improve health care and provide peace of mind for our members and their families? So as Congress hammers out a final health care reform bill, AARP pledges to you to provide timely information so that you can decide what health care reform will mean for you and your families. So no matter which way the debate goes, we'll be fighting for you because your health is worth fighting for. I thank you again for joining us this evening, and I appreciate your time and interest in this important discussion.
Thank you, Dan.
Well, to echo some of Gaylene's as well, first, Perry, thank you again for including me in the panel. And I think to sum up what I feel about it is that I think it was important for people to see and understand that we can have a divergence of opinions and positions on some of these issues, which are very heavy issues. They're very substantive in nature. And the fact that we don't agree on all doesn't mean we can't debate and discuss them in a professional and courteous manner. And I think that adds a lot to the audience that we have tonight. I do appreciate you all taking your time to be involved. Clearly, it's a topic that is important and passionate to a lot of people. And we're going to have a lot of opportunity over the next few months as we continue to look at this to have additional discussions and debate on it. And I encourage you to stay involved. We're not always going to agree on the same points, but I think having people involved in the discussion is critical to the success of it. And clearly, we all have a lot to give in order to make it something successful. And just to echo the original sentiments, what we're doing now is not sustainable, something has to occur. Thank you.
Perry?
I'd like to thank everybody for coming. And one of the purposes of this forum was to show the wide divergence of opinions on healthcare, to do it in a constructive and civil manner, and to really set a new tone for the healthcare debate. And I think Charleston really has set the gold standard for that making it a civil, constructive manner, and you were a great part of that, and I appreciate it.
I'm thinking of a line from Ted Kennedy's letter to the president, where he said that the state of a family's health should not depend upon the state of that family's wealth, and that health is not simply an absence of disease, but is complete physical, emotional, and social well-being of that individual. And if I had time to preach a little, I would read from the text about the Good Samaritan. That's what we need to teach tonight, to make sure this happens for all Americans. Thank you.
Thank you very much for the opportunity to participate in a civil discourse with very civil people and very enlightened and thought-provoking questions. I continue to believe that it makes sense to take time to get this right. That doesn't mean we have to take a lot of time. I haven't heard anyone on this panel say that he or she opposes health system reform, but I have heard a lot of discussion about what will make for good health system reform. I would like to see us make sure that we have built in adequate opportunities for additional education for physicians and allied health professionals. I'd like to see us take the time to have a serious debate about the advantages of legal reform to our system. I would like to make sure that as a result of any bill that passes, people who need a medical home will have an opportunity to have and find a medical home. I would like to make sure that any bill that passes helps assure that we all work on our individual responsibility for our own health, for taking care of ourselves and those around us. And I would like to hope that any bill that passes would contain incentives for both individuals and employers to provide for health coverage for themselves. Having said that, I think there's much that we agree on, and we can build from here. Thank you.
And I too would like to thank everyone who took time to be here tonight, and I personally have enjoyed this. Perry, thank you very much. And the AFL-CIO, I get up every morning and I'm privileged to work in a job where social justice as well as economic justice is my focus. But I would hope, as a result of the discussions going on in this country and the proposals before our Congress, that I might have fewer conversation with those who have jobs and those who have lost jobs that don't center around concerns of health care. I know that in West Virginia last year, of the approximately 5,400 bankruptcies, 62% of them were the direct result of health care costs. As the lady that was at the microphone, my own son wanted to start his own business and was prohibited from doing so because he has 2 children and his current employer provides health care. Couldn't leave his current employer because of the need for health care that he couldn't afford. I hear folks talking about wishing their lives away. Workers who've recently lost their jobs and they're in their 50s and they're hoping that they'll reach 65 and qualify for Medicare so they again will be able to have health care. I don't know that there's any more important issue before us today as we face many challenges. And I think groups like this across the country are going to help find solutions, and I look forward to the day that every American has health care. Thank you.
Let's move on. By saying this is just the ongoing discussion of healthcare reform, and I think Frank said it. Now's the time to voice your opinion both on the local level and at the federal level. You have every opportunity to participate in this process. Tonight was part of that, but also, give your congressman, and senator, and those people who are involved in this a call and talk to them.